Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modukwe. We bring you Sound Health every Tuesday at 6:30 p.m. and we try to enlighten members of the public on trending health issues from around the world. Today, we are trying to review the health sector in the year 2025. In few weeks' time, the year 2025 will give way to year 2026. How has the sector fared in the last 12 months? What are the highs and lows in this year? Stay tuned. The conversation begins after this break.
Since the inception of this administration, our work has been firmly anchored on our Tips Plus agenda, which has been a framework that continues to guide the transformation of Lagos into a safer, smarter, greener, and more inclusive megacity. Year after year, our budget has been structured to move from stability to reform, from reform to expansion, and now from expansion to shared and enduring prosperity. On our sectoral allocation, health will have 338 billion 449 million 258,900. To this end, 2026, we will expand access to quality education, we will strengthen healthcare delivery.
The program is still Sound Health on Lagos Television. Joining us via Zoom this evening to look at the health sector in year 2025 is Barrister Adebusoye. He is the chairman, Public Health Sustainable PHSAI, and he is going to tell us, we'll review the health sector in the year 2025 together briefly. Good evening, Barrister Adebusoye, and thanks for joining us.
Good evening, viewers.
All right, across the world, in Nigeria, in Lagos State, the health sector saw some remarkable progress, some high points, some low points. To start with, as we begin this analysis, tell us, how did the health sector fare in the year 2025?
Great. Yes, and Happy New Year in advance to everyone. Nigeria's health story in 2025, it's not just about spending money. If we look at it, about spending more money, it's actually about seeing that what works, proving it can save lives, and deciding whether we're bold enough to scale it into 2026. And some key points that came up was that 2025 marked a turning point. There was higher public health spending at the federal and state level. There was some clearer reforms Dr. Pate, the Minister of Health, brought about, and measurable gains in maternal and child health. 2026 is shaping up as a make or break consolidation year, especially for primary health care, health financing, and equity. Lagos State itself offers a real world laboratory for what works in its dense, fast growing urban setting. We're looking at about 30 million population estimate, according to Lagos Bureau of Statistics. And let me start at the federal level, then zoom into Lagos, where these reforms meet everyday reality. At the federal level, we have, for the first time in years, we're seeing consistent signals that maternal deaths are coming down and service coverage is improving. From the stats that the federal Ministry of Health gave us, we see that the reforms contributed to double-digit percentage reduction in maternal deaths. And these were based on facility data, not the general survey data, but facility-based data. There was actually reduction. There's improved skilled birth attendance and immunization coverage. Although these gains are fragile, but they are real and they are not theoretical. And I think every improvement we get, we need to celebrate that and move on. The Basic Healthcare Provision Fund, again, began working closer to its original premise. It started behaving like a system reform tool, not just a budget line. We saw that there was expanded accreditation of the PHC facilities. There was also increased enrollment of poor and vulnerable Nigerians for free or subsidized essential services. We see at the NHI level, they're capturing about now 20-something billion Nigerians, both at the state and federal level, being covered by health insurance, as opposed to like 16 million about a year ago. So there's some increase, good increase in that. Now we know it's mandatory. National Health Insurance Authority Act is mandatory for all residents of Nigeria. So it's something which there has to be constant improvement and scale up, both at the federal and at the state level. And Lagos State, I believe the figure is about 2 million now, but 2 million for enrollments in Lagos State. So there's a stronger reach into the rural and underserved communities as well through coverage gaps. But still their gaps remain. Both outcomes follow money issues, and 2025 saw a major shift in health financing. We see, for instance, at the federal level, the federal health budget increased by nearly 60% from 2024 to 2025. We see that, for instance, about 131 billion health spending in 2024 to 298 billion in 2020 by 2026 for medium-term spending. So there's that increment. There's also 150 billion for vaccines, and this is very, very important now that a lot of development partners funding, you said, it's been cut off completely. A global fund, even WHO, all their fundings are reduced. So this is very, very key. These are the partners that used to support our vaccine delivery. The private healthcare also has been repositioned at the backbone of the system. And we see that there's primary healthcare funding explicitly in the 2026 to 2028 MTEF projections, and also the Basic Healthcare Provision Fund. And in Lagos State, for instance, we see that Lagos has been focused hard on mothers, babies, and systems. With the 2025, we see there's upgrading of 47 of the 327 PHCs. This happened as well. They've strengthened the 6 health districts for decentralized accountability. We have 6 health districts, so that has been strengthened. And then there's the MAMI that was rolled out, the maternal and neonatal mortality reduction intervention, Lagos State. So there's emphasis on data-driven action, not just infrastructure. And I think that is key, because you may build hospitals, you may build facilities, but if you don't have data to back up what you are doing, then it just means you're just spending money without getting outcomes. This is the way we have outcomes. With regards to nutrition, we have prevention and partnerships. We have, of course, the maternal child week, where they actually delivered increased ANC, that's antenatal and postnatal services. There was family planning covered, gender-based violence issues. So quite a few of these things have been happening at Lagos State. There's also the Mama base, where high-risk women are identified early. They're followed up closely and delivered in strengthened facilities. Maternal deaths, can fall by up to 90%, because we see that maternal mortality ratio of 123 per 100,000 under the Mama base cohorts, those focus areas. There's been reduction in the tracked pregnancies, like 99.9% maternal survival. Of course, these are in facilities, so facility-based. Over 80% facility deliveries and strong ANC attendance. So while this matters nationally, that our maternal mortality rate in Nigeria is one of the highest in the world, most severe in the world, and the gap tells us that these, deaths are, they're not inevitable. So if we can actually focus delivery on improving our service delivery, we can actually see that we can actually get to where we want to be. However, there are challenges. We have issues with regards to inequity. For instance, Lagos State carries a heavy burden. Lagos is succeeding in pockets, but the statewide picture is still worrying. We have issues of, they're still quite high, maternal and infant mortality. We still have referral delays, especially in underserved communities. We have communities in riverine areas and by the lagoon, offshore areas, where there's a lot of referral delays. There's no facility in some of those areas. We have issues of blood shortages. That's a huge concern we have in Lagos State. An issue of transportation, of course, ICU gaps. And so persistent inequities persist in Lagos, despite all these reforms. And that's one thing we'll look at maybe going forward in 2026, how to improve that. Right. Thank you.
All right, so I'm glad we started with the eyes in the year 2025. Were there any remarkable achievement for you as a key player in this industry?
Yeah, so the aspect of one, in Lagos State, for instance, the mandatory rollout of the health insurance has been instituted. The executive order by Mr. Governor is empowering Lashma to actually coordinate with other MDAs to ensure that these the health insurance aspect is rolled out, especially to the informal sector. So I think that is very, very key. And we see, of course, the reform which we mentioned, rehabilitation of some PHCs, about 43 of them, in Lagos State. We see that the Basic Healthcare Provision Fund, of course, that has even come in, and that's something we need to track in Lagos State. We see the red letter from the Honorable Minister of Health, where he mentioned that specifically funds had been disbursed in Basic Healthcare Provision Fund 2.0. And so it's for us to actually track that in the health facility. You know, health outcomes are things that take a while before we can actually ascertain properly the impact of interventions. And those impacts are, maternal mortality reduction, child mortality reduction, child nutrition improved, like that, enhanced. So these things will take a little while to be able to track, but at least if we can begin to see the funding going into the proper channels in the health sector, then we can be sure of actually having positive outcomes. Another thing that is really key is the fact that there's been a lot of developments with regards to the health insurance scheme, a lot of innovations. Just recently, the Lagos Lashma rolled out some diaspora programs where those Nigerians who are in diaspora and those who come can actually get enrolled seamlessly into the health insurance scheme. So we are looking at various interventions to increase those who are actually enrolled on the health insurance scheme in Lagos State. And that's something very notable. I think it just needs to be improved upon. Yeah.
Okay, so I'm glad you mentioned a lot has been ongoing in the health sector in the year 2025. You also mentioned that revamping the sector, most facilities without adequate data is an issue. Can we talk about access? Did access to these health facilities improved? Because I know because of high increase in out-of-pocket spending, many people still shunned the health sector. Can we look at access even at the primary healthcare systems?
Because one of the main reasons why persons don't access private healthcare facilities is because of the state of the facility. Or they may go there and the infrastructure is in a poor state, no water, no light, no health worker, or health worker that just comes at a few periods a day. So that is something which is very, very key to ensuring that persons' access is to ensure that there is even a standard facility for them. And that's something which the state government has, over the years and in 2025, tried to encourage. It's still work in progress because we have so many facilities that still need to be, we have over 300 in Lagos State. And they've upgraded 47 of them, so you can imagine how the gap that is needed. With the 6 health districts being strengthened, that also helps to ensure accountability. So it's still a lot of work that needs to be done. There's still a lot of coordination that needs to be done. And there still needs to be a lot of that accountability, especially with regards to the World Health Committees and the local government health authorities, which are not yet in place. Because these are the things that will ensure that governance at the community level, at the local government level, to ensure that the primary health care facilities are accessible to all. There's still that gap. It's still state heavy, where the Lagos State Ministry of Health or the Primary Healthcare Board has to take the decisions. The local government health authority needs to be established, functional. They had been established theoretically some years ago, but with the advent of the new local government chairman, there needs to be that re-establishment, reconstitution of the local government health authority to ensure that it's not just for political appointees, not just for friends, it's actually for those who are committed to ensuring that the community level, at the local government level, the ward level, health is made accessible to all. So in a nutshell, this is what needs to make the private healthcare facilities accessible. Strong local government health authorities have to be established, and the World Health Committees have to be put in place. The Basic Healthcare Provision Fund recognizes those structures in ensuring that they administer, there's accountability for the Basic Healthcare Provision Fund, in ensuring that the primary healthcare facilities have their constant improvement going on. But if that is where we have to, in the state level, have to ensure that this happens. We have to ensure that we put in place those local government authorities, and they are functional, because they are the ones who actually even ensure that plans are made for each PHC. They are the ones that can ensure support comes in. The local government health authority has the power to even mobilize funding, financing at the local government level, and ensure community ownership at the local government and community level for each primary healthcare facility. So this is a very serious gap that has to be addressed in 2026. The establishment of proper, effective local government health authorities and the World Health Committees. It is key. Without that, they will not be able to actually have that primary healthcare structure fully accessible and be sustainable at the local government and community level.
Two major issues that has been a clog in the wheel of progress in the health sector is the brain drain syndrome, as well as the continuous doctors strike, the health workers strike. Can you quickly touch on these? How do you think we can leave these particular aspects behind in 2025?
Well, the Lagos State is also, they've established, there's a law in 2025, what they did, they've even, the bill has been passed, establishing a University of Medical Science, and the idea is they'll be able to produce thousands. I think there's at the 3,000 or 4,000, there's a target within the next few years. Once it gets operational, the University of Medical Sciences, and the whole target is to be able to plug that gap, that deficit in Lagos State in regards to the healthcare workforce, doctors and nurses especially. That's one, to be able to produce more. But another thing is to retain, because if they produce and they still jump. So the retention, we've been advocating for there to be a different salary structure for the health workforce, because their job is different. We saw during COVID, for instance, that everything stopped. All work stopped everywhere, but the health workers were the ones that were still working. So we need to understand that we have to decouple the health workforce salary structure from the ordinary civil service structure. The aspect of a per month issue, ensure that it's per hour, so that they could work as it's happening anyway. In many cases, many of the doctors that you see who own private hospitals are also in the public sector. But let's now make it proper. Let people be able to work for hours, one, so that they could, and their own rates per hour should be commensurate to what they're giving in. That's something that a board, a committee can work out, look at international best practice, pro-rata it, and make sure that doctors here get paid. There was a time, my father, who was a retired surgeon, mentioned that in the 60s, our independence, people would come from the UK to come and do their residency here because the pay was better. That's why you can see, like, UCH was ranked as one of the leading teaching hospitals globally then. So the way we can retain our workforce is to ensure that they get proper remuneration, proper facilities to work with. One is remuneration, another is facilities. They should be able to have access to easy mortgages for property. Make sure that if they're going to hard to reach areas, there's provision for them to stay there. Vehicle allowances. These are the things that can make people, the health workers, the doctors and nurses, to think properly about whether they need to relocate or stay. Even in the UK where they're going, we see that the doctors are even on strike recently. The nurses have been on strike. So it's not like everything is hunky-dory there. Everywhere there are issues. But at least if we can make this some basic improvements and not just, and decouple it, that's the point. You can't keep it on civil service scale, so that and it should be flexible, so that they could come in and do some hours of work in this facility, go to another, because we need them in different places. Also, those who have retired, there must be a way of engaging them even into the public health system on some kind of it's an hourly contractual basis, so that we can have, because we have a lot of doctors, nurses who are past the retirement age and are still very, very capable of rendering service. Those are things that we look at to ensure that we increase this workforce. Then we also look at even how we could, there's the tax shifting, tax sharing policy which Lagos State has just reviewed recently. So to see how other cadres can take up the work of the other cadres who previously they were not doing. So these are various areas where we can try and balance and get the health workforce challenge addressed. Thank you.
All right, but do you see these doctors, especially the young ones, stay behind despite having all these provisions in place?
Yeah, I know if the provisions are in place, why are people going to other climes? It's because some provisions are not in place. And again, you can see that globally, everything is changing. Now, most countries have become more hardline with regards to immigration. We see that America is making it clear that they don't want, under Trump, they prefer to have immigrants from Europe than from third world countries, and also Canada and all the countries, UK. You see how the immigration phobia is getting in play. So it's going to get more and more restrictive in any case, that for people to migrate. Of course, usually for health, they always try and squeeze them in because everybody thinks of their health first. So even during COVID, we see that there was a whole move to recruit and get doctors and nurses from Africa, from Nigeria. So I think the mood globally is already changing, that immigration is being frowned at. People have become more xenophobic, more nationalistic, etc. And so the tendency, those opportunities are closing. Flip it here. Once our own governments can begin to look at those and focus on it, because after all, if you can pay legislators, senators, and House of Rep ridiculous amounts for doing very little, those who are working, previously, and it's not workers, previously, we're aware, doctors, lecturers and all, they were getting more than all these politicians in the 60s. So, and things now be turned around and we see the way it's ended up. We need to address the problem. We need to know that this is a big issue. There's no country that develops if its health systems are poor. There's no country that develops economically if its health systems are shallow. There's no country that develops if its education is shallow. We have a situation where we have our best brains, our doctors, everybody knows they're good, and that's why all over the world, wherever you go, in all these places where people go abroad, Nigerian doctors and nurses are the ones attending to them. So if our training wasn't good, they wouldn't be useful abroad. So we are training excellent doctors and nurses. We just need to make sure that the environment is conducive. And of course, that is not restricted only to the health sector. It's the whole economy. It's the whole issue of security. There are some areas especially in the north, in some places of the south, where even youth couples don't want to go now, if they are posted. So a doctor would not even want to go there, and so some things have to be addressed by the government. The issue of security is key, because that's the first thing. Make sure that every local government is secure, is safe. You won't go and kidnap the doctor who is there. Otherwise, nothing you can speak about. So there are some things that go beyond even the health sector. And of course, number one is security. And number two is even the aspect of infrastructure, the quality of life, the kind of education that is available. And all of it is possible. We have all the resources here. It's just for us to get our priorities right. Don't have situations where we have, like we're hearing of some government regulator, the oil sector, spending billions for his children in schools in Switzerland, when you're not fixing your own place, and you're from a place where they need all this infrastructure. So if our leaders can begin to prioritize and see that if they don't do so, it won't even be in their own self-interest. It's not in their self-interest. When you can't go to your own country, your own town, and be treated, you can't stay in your country, a little headache, and you go to France or you go to the UK. So we need to have a mindset, a change of mindset, where we know that the priority now, take care of the health workers. When we talk about the health system, it is mainly health work, force and the equipment. It's not the building. But building we saw during COVID, there were tents and canopies that were just made into health facilities. But you needed the equipment, the drugs, and you needed the personnel. Those are the two things that you need in the health system, not building big multi-billion naira building. Buildings don't heal anybody. It's the people that do, and it's the proper equipment and medicine that does. How will that happen? We make sure we fund it. There has to be more money for better outcomes and proof of what works, data. Whatever works, we should get the data of that and replicate. The real test for 2026, do we have the political will to scale? That is the test. Thank you very much.
Do we have the political will? 2026, we'll find out by God's grace. Thank you so much for your time. Barrister Adebusoye.
Thank you very much. Blessed day. Happy New Year in advance to everyone.
Truly, the health sector in the year 2025 recorded some remarkable achievements, some highs and lows. We are hoping that in year 2026, Nigeria as well as the Lagos State government consolidates on the gains as well as improve financing through improved budget performance in year 2026. This is where we wrap it on today's episode of Sound Health. For comments and inquiries or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television, #Sound Health. A sound health is a sound mind. Make healthy living your choice.